Welcome to this office hour session on the Supplemental Nutrition Assistance Program, also known as SNAP. I'm Shayla Bottoms, and I'm a Technical Assistance Specialist for the Grandfamilies and Kinship Support Network at Generations United. We like to refer to ourselves as the network. We would love to know who's with us today, so feel free to introduce yourself in the chat. And in case you are new here, I'll share a little bit of background information about the network first. We are the first and only National Technical Assistance Center on Grandfamilies and Kinship families. We work with states, tribes, and nonprofit organizations to improve supports for the families. We do this by offering individual assistance to professionals serving families, developing resources, hosting webinars, and more, all free of charge. You can learn more about us by visiting our website at gksnetwork.org. We do this work with the help of 5 national partners and various subject matter experts, one of which is the Food Research and Action Center, or FRAC, who will briefly present some information today and be answering your questions. But before we dive into the content, I do want to highlight that this is a bit different from our typical webinar format. Today's session is designed to be informative but interactive. So we won't be addressing case-specific questions, but if you have a personal question or need assistance with your personal SNAP benefits, one of our subject matter experts from FRAC will be dropping a few resources in the chat that may be helpful. And at this time, it's my pleasure to introduce Dory Thrasher, who is a senior SNAP policy analyst at FRAC.
Thanks, Shayla. Hi, everyone. I'm Dory Thrasher. As Shayla said, I'm the Senior SNAP Policy Analyst at the Food Research and Action Center. A little bit about FRAC. We were founded in 1970, and our organization works to improve the nutrition, health, and well-being of people struggling against poverty-related hunger in the United States through policy, advocacy, and partnerships. FRAC has been working with the Grandfamilies and Kinship Support Network to create resources on many federal nutrition programs. Today, I'm going to talk about SNAP. I think my plan is this. I'm going to give an introduction to the program for people who may be less familiar. Then I'm going to talk about some of the recent changes to SNAP and how they might affect Grandfamilies and Kinship families. And I will leave plenty of time for questions and discussion. I'll pause, so you're welcome to put questions in the chat or to come off mute when we have pauses for conversation. Really happy to hear what everyone has to say and answer specific questions, but like Shayla said, not individual specific case questions, sort of more broad questions about SNAP, but we can point you to organizations or people in your states if you've got specific questions. I am going to start by putting my email in the chat. If you need to reach out to me, I can help put you in touch with other people, and I'll put that in again at the end. Okay, so first off, SNAP. So SNAP is the Supplemental Nutrition Assistance Program. It has been a federal program since the 1970s, but it is administered by the states at the state level and a few states at the county level. SNAP provides a monthly benefit that can be spent on food at approved vendors, and by food we mean groceries, not restaurant meals. It is delivered on a debit card called an EBT card. SNAP participation is at the level of the household. So eligibility and benefit amounts are determined based on household income and the number of people in the household. That eligibility determination is generally 2-step, looking first at gross income, so the total amount of income a household has, and then the net income after expenses. So the gross income limit is generally about 130% of the federal poverty line. It does vary a little bit state to state. That is about $20,000 a year for a single person, or $35,000 a year for a family of 3. Then in the benefit eligibility calculation, once expenses are deducted from your gross income, a household's net income has to be at 100% of the federal poverty line. I will say that households with an older adult who is 60 or older, or a disabled person, generally don't have to meet the gross income test. Only that net income is looked at. A handful of states, not many, have an asset limit, which is the maximum amount you can have in savings or other valuable assets. SNAP benefits are administered monthly on the debit card. The monthly benefit amount also varies based on a household's income and the number of people in the household. So the maximum benefit for a single person is $298 a month, and for a family of 3, it would be $785 a month. What else? Okay, so even though SNAP is always counted at the household level, there's one situation in which children can receive SNAP without the adults, which is that if their parent or other caregiver is ineligible for SNAP because of their immigration status. In that case, the children can be a SNAP household, but the adult would still hold the card. Okay, so a few other key points about SNAP I want to raise. So first, SNAP is an entitlement program, which means that it is available to anyone who qualifies. There's no cap on the number of people or households who can participate, and there are no wait lists. Second, SNAP complements other nutrition programs, including WIC, the Supplemental Nutrition Program for Women, Infants, and Children, and school meals. You can receive all of those. In fact, SNAP participation can make your household or your household's kids automatically eligible for WIC or for school meals or for summer EBT. A point that is of possible particular interest to grandfamilies is that there are some special SNAP rules for households with older adults in them, which is defined in the SNAP program as people 60 and older. States that participate in something called ESAP, the Elderly Simplified Application Process, will streamline SNAP application and recertification if all the households are over all the adults in the household are over 60 or disabled and have no earned income, that is, wages from work. There are also a few special rules for formal foster parents. Foster kids can be included in the SNAP household or excluded. So if they are included, then foster care payments are part of the household's calculated income. But if they are excluded, then that income does not. Previous FRAC work on SNAP and grandfamilies has shown that only about 42% of likely eligible grandparent-headed families participate in SNAP. That data is from 2019. So this is a moment where I would like to pause and open it up to questions if anybody has any questions about how SNAP works or, excuse me. You can put questions in the chat or raise a hand. Samantha, I see your hand.
Hi, Dory, and thank you for doing this training. I really appreciate it. But can you explain? I've been to one of the grandfamilies.org training, and in one training, they did talk about how SNAP benefits, how could, there was like an exemption where some states have SNAP benefits for just the child, like in kinship families, where we can use a child-only TANF or SNAP. Is that only for TANF or that's for SNAP as well, a child-only SNAP?
So for SNAP, there is only one state that has a child-only program, and that's Minnesota. It's a very long-standing program. They've got a special relationship or special agreement with USDA to operate that program, but it's not available in other states. It's a
So
good question.
TANF is what's available, a child-only TANF, not child-only SNAP.
Yes, TANF is available in child-only versions.
Okay, thank you. I had it confused. Thank you.
Yeah, you're welcome.
Well, since no other questions, can you explain how can we use SNAP for our kinship families, how it's available for them? Because I work primarily with kinship families, and I'm curious of how are they available for our kinship families to get access to them? And if their income would they have to use their income, our kinship families, if the child is in foster care?
Right. So SNAP is available to a household, which is defined as a group of people living together. A household does not have to be people who are formally related, as long as they share food and cook and eat meals together. That is the sort of definition of a SNAP unit. And the entire household's income, both earned income and unearned income, so things like wages from work, but also disability payments or child support, get counted in the income calculations. When you apply for SNAP, I think almost every state you do it online, you fill out household information. It gets, there's 3 steps to the process. There's the application form itself. there is an interview you would have with a SNAP caseworker to cover eligibility questions, and then you would submit verification documents about income and expenses, and then your eligibility and your benefit would be calculated. And the question about foster family is that if children are in the formal foster system, you can actually choose whether or not those children are part of the SNAP household and count their income, and then you would get the benefit for a household that includes the children, that number of size. You could also choose to exclude the children from the household and calculate it based only on the adult's income, but then you would get a benefit value based on just the adults in the households, like that household size. If there are no other questions about SNAP broadly, I will move on to the next section, but there'll be more
Sorry.
opportunities for question. Oh, yeah.
I could not find out how to raise my hand, but can you elaborate whether to exclude versus including the foster child in your household? We're currently working with a kin family, and grandmother just got her grandchild in her home, and they're trying to access SNAP benefits, and they're having a lot of issues because the grandmother's trying to do it versus like the social worker doing the application process. So can you just go over a little bit more detail about that?
I think that the most useful thing is that SNAP is an extraordinarily complicated program. There are a lot of a lot of moving pieces, a lot of different if-then statements in eligibility. And a lot of states are mildly to severely understaffed. So not every caseworker is going to know everything or get it right on the first try. So SNAP does have a system called fair hearings, where if you believe that something has gone wrong, that you were improperly denied, that your exclusions were not properly calculated, everyone has the right to call a fair hearing and have present your case in front of a third party, like an administrative law judge, who will look at the matter and determine that you should have been getting SNAP if you have been improperly denied.
What is the point of excluding, like, as an example, the foster child from, why would you do that? Or what?
Because there is an income cap for SNAP eligibility. So it's 130% of the poverty line. If the foster care payments you're receiving puts you above that, then you would be ineligible for SNAP. But if you, on your own, have a modest income and you are below the poverty line, you might choose to exclude the foster children from that for the benefit calculation. You would get SNAP if you were just a single grandparent as a household of one, but you could be getting up to, what did I say, $298 a month in grocery benefits.
Is there any implications? Like, what if she needed, obviously, the food to provide? Would she just use then like her stipend for the child to pay for whatever food he needed in the home? Is that how that would work if you did exclude the child?
Yes.
Okay.
And the one thing also that is true about the way the SNAP benefit eligibility and benefits are calculated, it assumes that a household is spending a third of their income on food, and that's based on a basket of food items called the Thrifty Food Plan. And the sorry, the math is a little bit complicated, but basically, if a third of your income is less than the cost of the food basket for your household size, the benefit amount is like the balance between those. And also, if people are struggling to afford all the food that they need with SNAP and foster care payments and all of that, there are networks of food pantries across cities and states that are also available resources.
Thank you.
For your question. Okay, I am going to move on and talk about some of the recent changes to SNAP that have come out of HR 1, the budget reconciliation bill that was passed in July 2025, sometimes called the One Big Beautiful Bill. We don't like to use that phrase. So the main change that came out of that law concerns time limits. So SNAP participation is actually time limited for a group of people that are called able-bodied adults without dependents, ABODs, ABAWD. People in this category can only receive SNAP for 3 months in a 3-year period if they don't document work of 80 hours a month or participate in an employment and training program. There have always been people who are exempted from these time limits. This includes people with disabilities, caregivers, pregnant people, people in substance use disorder treatments, and some others. But HR 1 changed who is subject to time limits. It narrowed the amount of people. So for grandfamilies, I think the important points are that it expanded the age range of this adults designation from age 18 to 59 up to now 18 to 64. So people age 60 to 64 without dependents must document work participation to keep their SNAP. However, it also redefined dependents to mean kids under 14. So now people who are caregivers for children aged 14 to 18 have to document work participation to keep their SNAP. It also eliminated the exemption for youth under 24 who had been in foster care. I do want to point out that caregiving for children is operationalized as there being a household member under 14, even if you are not directly responsible for their care. So for instance, if you have care of siblings who are 10 and 17, and then the older child turns 18, they would still be exempt from the time limits because there is a child under 14 in their household. A second HR 1 change is about who pays for SNAP. So up until now, the federal government has covered 50% of SNAP administrative costs, and the states have paid the other 50%. But starting this October, the states will now pay 75% of those administration costs. HR 1 also introduces for the very first time a benefit cost that is on the states. The federal government has always paid for the full amount of the actual benefits that people receive. But starting in October 2027, states are going to be required to pay for a portion of those benefit costs depending on their error rate. And now I don't want to get into the weeds on how error rates are calculated because that could be a whole other hour of discussion. But the main outcome is that states are becoming sort of much more anxious about making mistakes when processing cases because now they have a real financial penalty for that. So we are starting to see, and I think we'll continue to see, intensified scrutiny of households applying for SNAP, which is going to take the shape of increased need for documentation of income and expenses, slower processing times, probably increased denials because states don't actually have a penalty for improperly denying a household SNAP, but they do see penalties for approving households that shouldn't have been approved or giving a household the wrong benefit amount. So the incentives here are misaligned, I think. I think that this is going to affect grandfamilies because multi-generational households can be seen as more complex in the SNAP application process. It's going to be harder to submit, say, a birth certificate showing that someone is your child, right? So they might be flagged for extra review or extra required documentation. I think these cost shifts are also going to put extra pressure on state budgets, and we're not really sure what those outcomes are going to look like or what kinds of programs or services in other areas might be scaled back so that a state can afford to operate the SNAP program. And then finally, HR 1 introduces some changes to the benefit calculations that will reduce the amount of benefits that some households get. There are changes to how utilities are deducted from a household's income. For one, internet costs are no longer an allowed deduction. And there are some changes to how the maximum SNAP benefit is adjusted for changes in food prices. So this is like another place where we can pause and answer any questions that you might have about these changes to the SNAP program, changes to eligibility and to time limits. Susan is very helpfully putting some of our FRAC resources on these HR 1 changes in the chat. So And if there are no specific questions now, feel free to ask them as they come to you. I have a few more other bits of information about SNAP that I want to share. I wasn't sure sort of what category to put these under. SNAP is, as I said, a really complex program. It has a lot of moving pieces. So I'm going to highlight a couple other issues that I think are of particular interest to grandfamilies. So the first is about individuals moving between SNAP cases. So SNAP benefits, as I said, are at the household level, but every individual in the case is accounted for and like mapped to the case level. So if children are part of a case with their parents and are now living with a grandparent, it is important that they get moved to the SNAP case with their grandparents or with the household that they're living in. And I understand that these moves can be like potentially fraught, especially if the children's parents might be relying on the SNAP income they get for a larger household size. But it is important to know that SNAP agencies can later force households to pay back benefits that they maybe received improperly if it turns out later that they realize that they weren't eligible for them. So if you are collecting SNAP for a family of 3, but your child is living somewhere else, it might be determined that that child was not eligible to be part of your case, and they might have to pay those benefits back, which can be a huge burden and a huge hardship for people who are not expecting it. So it can be more beneficial in the long run to make sure that kids are counted with their correct household. The second thing is that if there is a joint custody situation with kids spending time in multiple households, they can only be counted as part of one household. There are not very clearly defined rules in the SNAP program for determining which household they're a part of. So it really is up to the family to decide. It's just important that they're only counted in one household. I do also want to talk a little bit more about how the SNAP unit is defined. I said before that it is technically people who share food and cook and prepare meals together, whether or not they are related. It is possible for a group of people who are living together to exist as multiple SNAP units within one residential dwelling if they eat separately and they don't share food. This is mostly common among unrelated roommates. It is not allowed, though, for people who are under 22 who are living with their parents. It is assumed that those adult children are still cooking and eating with their family unit, even if that may not be the case. There is, however, flexibility here for people who are living with non-parent caregivers who are not legally adoptive parents. The rules are really clear about parental relationships in this particular point. They say that a person under 22 years of age who is living with his or her natural or adoptive parents or step parents must be part of that case. The third thing I wanted to point out is that there has been recently, in the past few years, a very upsetting amount of growth in stolen SNAP benefits. This is often called skimming. These thieves will like put devices in the SNAP readers that copy card information and then use people's SNAP benefits. For a while, there was a federal program to replace lost SNAP benefits, but that ended in 2024. So there's, at this point, no recourse for SNAP benefits that get stolen. And the instructions that states are giving to SNAP participants is to use an app made by the card processor companies to freeze their EBT card. So it means like it cannot be used until it is then unfrozen. But of course, this is an extra step, and I don't want to make any assumptions or perpetuate any myths about the technological capabilities of older adults. But of course, any extra step that require things like apps and logins can just make this harder. And then the fourth, maybe final point is about volunteering to meet work requirements. So earlier on, I mentioned the expansion of time limits to even to older people aged 60 to 64. Their ability to volunteer to meet the 80-hour a month requirement has been available for a long time, but it's been getting a lot of extra attention since the passage of HR 1, especially as it concerns older adults who might be out of the labor force and then face challenges re-entering it in order to meet the SNAP eligibility rules. Older adults have very high rates of volunteering, and the states that have been pushing volunteering, I think, are doing this out of like a good faith effort to prevent people from losing their SNAP benefits. But it's not a magic bullet. But for people who are already involved in some sort of volunteer work, it can be a really good option to help people maintain their benefits. So I'll pause again here if there are any other questions. And if not, I have some questions for this group, which I would love to hear about any other challenges that people in your networks or people that you're working with are seeing related to staff access or time limits or any other issues. Or if there are any other kinds of resources that you think might be helpful for you or for the people and families that you work with.
Oh, sorry. Oh, wait. I'm so sorry. My phone is looking for that. If you want.
And my last question is maybe more of a philosophical one, but why do we think that the participation rate for eligible grandfamilies is only 42%? What do we think the sort of
Can you
broad
repeat that
barriers-
question, please?
Yeah.
No, I said, can you repeat it?
Oh, can I repeat the question? Yeah, sure. I would love to know why folks think that the participation rate in SNAP for eligible grandfamilies is only at 42%.
Well, I think I don't know because I'm stuck with the SNAP and the TANF, but I think that and maybe you guys can correct me on this because I know with TANF, some of my families don't want to apply for TANF because of the child support component that may come along with it, that they don't want to put their family members or their friends, whoever the fictive can, they're afraid that that's going to impact them and cause more issues with the parents of the children rather than pursue those benefits. I don't know if the same applies to SNAP as it would do to TANF, but that was my explanation of why many of our families are not getting TANF because they're afraid of putting their own children on child support, or they don't want to put their own children on child support.
That's an interesting point you raised. So there are 9 states that require SNAP participants to cooperate with child support agencies. And they have the ability to disqualify either custodial or non-custodial parents for not cooperating. USDA did a study on this a few years ago, and they found that it was not at all effective in increasing child support payments, and it caused people to come off of SNAP. So I think that you are right that that is a thing that is a barrier. It is encouraging that USDA, which is a federal agency that runs SNAP, I should say, like undertook this big research project because they really wanted to know if this was a valuable option and found that it was not. I see in the chat that Colleen has offered stigma broadly as a reason why people don't participate. Does that sound right?
In research on older people in general, at least in rural areas where I am, stigma is a barrier to SNAP and not wanting to take benefits from someone who needs it more, especially with older people. And then I'm guessing if you're caregiving, like you're in the midst of, I mean, you're just in the midst of chaos and stress on top of it. And then, that's like an extra barrier. And if there's any hesitancy, then you're probably really unlikely to seek out and go through all the steps.
Yeah, that all makes sense. I will repeat that because SNAP is an entitlement program, anybody getting it doesn't take it away from anyone else. So whatever we can do to dispel that myth, I think would be really helpful because they really want, like, people should get access to a program that can support them and their families and the kids are taken care of. Robin suggesting caseworker turnover and unfamiliarity with the rules. I think that's true. I think people don't necessarily know what's available to them. Being not eligible for SNAP as a person living on their own, you might just like not be aware that having more people in your household without more income wouldn't necessarily make you more eligible. I think the time limits rules, there's a lot of noise about them, a lot of discussion, and it's unclear and hard to decipher. And so if that makes people feel like they're probably not eligible, they're not going to take the step to apply.
Do you have any recommendations to encourage that we can share with our kinship families to support? Because a lot of it too falls down to workers. Some of the workers are not aware of what our kinship families are entitled to for them to even relay the information. So how do we get all this information to the workers, to the kinship families? That's what do you have any advice that we can do that?
Yeah. So Susan, again, thank you so much to my coworker Susan for putting some resources in the chat. This is a guide that FRAC put together with the network to sort of share some of these ideas and suggestions and best practices. FRAC also works with a whole network of anti-hunger advocates across all of the states. So I think it could be really valuable for you and your organizations to connect with some of those groups because they have a lot more like state-specific knowledge and understanding of sort of like the landscape, especially around caseworkers and how all of the different social benefit programs do or do not share information and talk to each other. We do know that, in our work with groups like in higher ed and community college campuses, there's a lot of people who don't know that they're eligible or don't understand the rules, and sort of making those connections at the places where people are rather than asking people to come into the SNAP agencies can be a really valuable form of outreach. I'm going to take this moment to type my email address in the chat again, because if you want to be connected to anybody in our network of anti-hunger advocates, in your state, please, you can reach out directly to me and I can help put you in touch with the right people. Christina, I really see your point about not wanting to go through the whole process for a low benefit. I think if people have had that experience in the past, it would definitely put them off trying again. With children living in your household, the benefits are going to be greater. So being able to help people message that and understand that the sort of trade-off of going through the hassle of submitting an application and doing all the application compliance is probably a far greater reward. And then I guess, again, I want to highlight that SNAP participation confers eligibility to other programs. So if you get SNAP, you are likely eligible for WIC, which is helpful for kids under 5, and school meals. In states that don't offer school meal for all programs, the process of applying for school meals can be another administrative hassle that nobody really has time for. But if you're getting SNAP, kids are automatically enrolled in school meals programs. So you get 2 for the price of 1. Which is not to say that I'm trying to like counteract all of these very good suggestions and insights that you all have that you're seeing in your work. I think the barriers are real barriers, and I think we're all working really hard to try and figure out how to address them, how to make sure people are making decisions with all the information they have and getting access to the food benefits that can help everyone with purchasing groceries, especially as grocery prices continue to rise everywhere. Everyone needs the support that they should get. We are all paying into our taxes to support SNAP, and everyone who is eligible for it should be able to receive it without stigma, without hassle.
Amen.
So again, I just want to make myself available for any further questions or support. My email address is in the chat. I can also, if you reach out to the network, they can put you in touch with me. We really want to be here to support all of the work that you do with families. So thank you for being part of this webinar office hour, and I'll turn it back over to Shayla to close out.
Thank you so much, Dory. Before we close out, are there any last questions or comments regarding SNAP? Right. Well, thanks everyone for joining us today. If you do have a question later, feel free to reach out to Dory at FRAC. Her email is in the chat again. And if you need it or if you missed it in the chat, just let us know. We'll make sure you get that email address. Today's session was the first of 4 office hour sessions that we're going to be doing on SNAP. The network staff will drop links to register to those upcoming sessions in the chat. And if for some reason you don't get to those links before we close out, which we'll wait a few minutes, but if you don't get to those, you will get those in a follow-up email as well as the recording for today's session.